Good afternoon, everyone. Today is Thursday, May the 21st. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our daily press briefing. Since our briefing yesterday, we have received notice of 94 new cases of COVID-19 here in Montgomery County. This brings us to a total of 6,213. 22 of these cases are from long-term care facilities, and 72 are from the community. These positive results are from 32 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 3 years old to 101 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated municipal information. The gender, we have 55 females and 39 males. None are known to be hospitalized. One is known to be at home in isolation, and we do not have information on 93. I am saddened to confirm that 10 more Montgomery County residents have lost their lives to COVID-19, which brings us to 558 deaths confirmed positive from COVID-19. 5 of these individuals passed away at a hospital, and 5 passed away at a long-term care facility or residence. They ranged in age from 50 years old to 101 years old. Overall, since the pandemic began, 307 females and 251 males have died from COVID-19 here in Montgomery County. Our self-reported racial breakdown: 13 Asian, 3 Asian Indian, 2 Asian Korean, 59 African American or Black, 164 white, and 317 unknown. We will not be reporting on probable deaths today. In terms of hospital beds, today we have approximately 270 individuals hospitalized with COVID-19 in our Montgomery County hospitals. This is a slight increase over our low point a few days ago of 250 hospitalized patients. Approximately 22% of these individuals are requiring a ventilator. We continue to work with 94 long-term healthcare facilities, or long-term care facilities. The facilities continue to share with us a self-report of the number of cases among their residents and their staff. Since the reporting began, we now have a total of 1,794 residents and 649 staff, for a total of 2,443 positive individuals at long-term care facilities in Montgomery County. Just a reminder that not all of these individuals are Montgomery County residents, and so these numbers do not tie in to our overall number that I gave you at the start of this briefing. We continue to do outreach with these facilities. Our FAST teams are making both new visits and revisits to facilities this week. We are awaiting confirmation of appointments for the CDC and National Guard teams that are due to come to our county, hopefully sometime next week, and visit 4 of our facilities that were determined by the Pennsylvania Department of Health. Our FAST teams will be accompanying the folks from the CDC, and hopefully it'll be a very collaborative and very helpful visit for everyone involved. At our Montgomery County Correctional Facility, everything is stable. All inmates that have tested positive for COVID-19 remain in stable condition. So I do have an announcement of a new community testing site today. We opened this morning a Pottstown walk-up community test site. Starting tomorrow, since today is already done, starting with tomorrow, individuals can register for testing at our Office of Public Health's Pottstown Health Center, located at 364 King Street in Pottstown Borough. Testing at this site will be available Monday through Friday from 11 a.m. until 1 p.m. by appointment only. The following categories of individuals are eligible for testing. Persons of any age with symptoms of sudden illness, such as fever, cough, shortness of breath, loss of smell or taste, or gastrointestinal symptoms, such as nausea, vomiting, or diarrhea, whether or not you have a fever. This includes first responders or healthcare workers who know that they were exposed to an individual with COVID-19 or themselves are experiencing any signs or symptoms. Anyone with known or suspected direct contact to someone with COVID-19 is welcomed to be tested, as well as anyone who's been recommended for a test by their doctor or any other healthcare provider. To register for an appointment in our Pottstown site, you can call 610-970-2937. That's 610-970-2937, starting at 8:30 tomorrow morning for appointments tomorrow, Friday. The site will not be open on the weekend or Monday, Memorial Day. The phone lines will remain open each day between 8:30 and up until 10 a.m. or whenever all of the slots are taken. So if you do try to call and no one answers, that probably means that the slots are taken for that particular day. Spanish-speaking operators, as well as a language line translator, will be available. And I just want to give a quick shout out and thanks to Nelly Jimenez from Aclamo for translating this flyer into Spanish. Testing at this site will be the self-swab approach, the same format currently being used at our Whippane and Norristown locations. The individual will be asked to place the testing swab in their nose as directed by personnel on site, and staff will be present to provide instructions and answer any questions throughout the testing process. You do not need a driver's license or any other form of identification. You do not need health insurance, and you do not need a prescription or doctor's order to be tested. Testing is provided free of charge, and there's no requirement that you live in any particular municipality. So our Norristown walk-up site continues to go very smoothly. They were open today. They are planning to be open tomorrow, weather permitting, at the Delaware Valley Community Health Center. To make an appointment there, you can call tomorrow morning at 8:30 a.m., 610-592-0680. And they also do testing 11 to 1, Monday through Friday. They will also be closed on Monday in observance of the Memorial Day holiday. And everything continues to go well at our Montgomery County Community College drive-through site in Whippane. Just a quick update on our testing there. For the dates between April 16th and May 17th, we've now tested 6,039 individuals. We have received results on 5,892, which is 98% of the total. 825 of these individuals have tested positive. So for 27 days of testing, we're running an average of 14% positive. This site will be open on Saturday. It will be open tomorrow and Saturday, but it will be closed both Sunday and Monday in observance of the Memorial Day holiday. To make an appointment for tomorrow, Friday, you can go online beginning at 8 a.m. tomorrow morning at montcopa.org/COVID-19. Click on the green County Testing Information button, or you can call 610-631-3000. And again, for that site, appointments open at 8 a.m. For the two walk-up sites, appointments open at 8:30 a.m. So knowing that the weekend is coming and it is a long weekend, although I'm not sure really what that means anymore under our current situation, I do have an announcement that today Governor Wolf signed House Bill 327, now Act 21 of 2020, allowing the temporary sale of cocktails to go from bars, restaurants, or hotels with a liquor license. The law takes effect immediately. The law applies to bars, restaurants, and hotels that have lost 25% of average monthly total sales during the COVID-19 emergency. The beverages must be sold in containers with a secure lid in quantities from 4 ounces to 64 ounces and before 11 p.m. at night. An additional seal is required on the straw opening of a lid. Within 60 days, bars and restaurants must use a transaction scan device to verify a consumer's age if the person appears to be younger than 35 years of age. And Pennsylvania's open container law applies. So I thought some of you might be interested in that news, and of course, encourage you to drink responsibly over this long holiday weekend. So I think both of my colleagues are here. I don't believe Commissioner Lawrence had any comments for today. Commissioner Gale, did you have any comments?
I do. Thank you, Commissioner Arkush, and good afternoon, everyone. Thank you for joining us today. This morning, the Montgomery County Election Board had a meeting, and I just wanted to give a brief update because over the series of these daily press conferences, we've updated the public on changes that are taking place regarding the 2020 primary, which is coming up on June 2nd. This morning during the Election Board meeting, I opposed an authorization to have ballot collection boxes at various locations across the county where voters could drop off their mail-in ballot in the box. I oppose this because it provides another example of why mail-in voting is very problematic. It's something I've been very critical of for several months. And about a month ago, we had an election board meeting where I opposed a $1 million contract with a company located in Ohio that is handling the outsourcing of mailing the ballots to the voters in Montgomery County. Historically, this was always done in-house by Montgomery County Voter Services. They would mail out the absentee ballots to the voters upon their requests. I've heard hundreds of complaints over the last couple weeks from voters in Montgomery County that have not yet received their ballot in a timely fashion. Also, voters who have received the ballots have had several complaints with various things, such as the return envelope being see-through, meaning that the return envelope was see-through, that you could see someone's ballot through it, and they're not pleased with the level of privacy that creates. Also, there was errors with the instructions that were included with the ballot. There was flawed instructions that directed voters to fill in the oval to the left of each candidate that they chose to vote for. However, the correct oval to fill out is actually on the right side of each candidate. And they're not pleased with the timeliness of receiving the ballots. So in reaction, we now need to have these ballot collection boxes placed across the county. I'm also skeptical of the security that would take place with a drop-off box. And this morning I brought up the concept of what prevents one individual from bringing a massive amount of ballots to the drop-off box. And this is a term frequently referred to as the harvesting of ballots, where a third-party organization would collect ballots from a voter and then take it to a drop-off box or to their voter services department in that county. So I believe we should do everything we can to have a secure election and have the election process as much as possible between the voter, their ballot, and no one else. No third parties in between a voter's ballot. And that's the whole purpose of having a traditional standard election day where citizens exercise their civic duty and vote in person so they can select the candidates they choose and cast their ballot. Before it used to be a machine. Now with the new mandate that there has to be certified paper ballots, now that ballot is paper, but I believe the person, the voter, should scan their own ballot and eliminate anyone in between that process. So that's something I strongly have been advocating for. I'm very disappointed with how this 2020 primary is being conducted in Montgomery County. This is not the first time I've expressed my disappointment with how Montgomery County conducts elections. My first year in office in 2016, there was a fiasco with absentee ballots in the 2016 general election, where hundreds of ballots went unaccounted for after a judge had to extend the deadline of the absentee ballot due date. There was an after-action review done after the 2016 general election with the purpose of finding ways to improve the process and create efficiencies. Yet, time and time again, we cannot deliver a smooth and successful election in Montgomery County. And I feel bad for the employees in the Voter Services Department that have to handle this high volume of requests for paper ballots, when the best and easiest way, in my opinion, is to exercise your right to vote in person in a standard traditional way. And this is something I will continue to push for. I hope we make improvements in Montgomery County. The county government has an obligation to deliver a primary and general election every year, and we have to do so securely, efficiently, and properly. And for some reason, Montgomery County can't seem to get it right. So to the hundreds of people that have contacted me with their concerns with their ballots this year for the 2020 primary, I hear you, and it's a shame that it's come to this, but you do have the option to vote in person on June 2nd. And I mentioned how there's such a high degree of confusion for this primary. On top of all this, Governor Wolf moved the primary election for 2020 from April to June 2nd. And the draconian stay-at-home order, which he has put into effect, is for June 4th, 2 days following the Tuesday, June 2nd election. So that stay-at-home order creates additional confusion. So I understand that a lot of residents of Montgomery County are concerned, are confused, and it's a shame it has to be that way in Montgomery County. And I encourage the voters to use common sense and exercise their civic duty to vote in person. I don't trust the mail process. Time and time again, if you look at other areas of the nation where it's been used with mail-in ballots, there's been a lot of problems, and we can see more problems happening here in Montgomery County. So I want the residents to know my take and why I vote the way I vote on matters that come up on the Montgomery County Election Board. And that's all my comments for today. And at this point, I'll turn it over to the press. Thank you.
Thanks, Commissioner. This afternoon, we're joined by Deanna Durante from NBC 10. Deanna?
Good morning, all. I'm watching the Facebook feed, or good afternoon. It's been a long week already. I'm watching the Facebook feed, and I see a lot of people talking about pools, and was wondering if you could talk a little bit about why pools and swim clubs won't be open until the green phase. People seem to think that chlorine and whatnot should kill the virus. Can you explain why the closure is the way it is for people?
Well, I'll take that. That is a directive from the Pennsylvania Department of Health, and I have no information that is specific to why they made that decision about pools. So I will have to refer you to them.
Okay, another question. There's a lot of talk about the nursing home data that was released by the state earlier this week. Some nursing home officials coming out and saying that they're not sure where the state got those numbers, that they appear to be inaccurate, that either their case numbers are way off or their level of fatalities is off. I know we talked several weeks ago about Montgomery County double checking its COVID positive patient data. Is any of this data checked by the county, or is this solely from the state numbers?
So are you specifically talking about long-term care facility numbers?
Yeah. Long-term care facility numbers, the cases and the fatalities. Some facilities have said that the numbers provided by the state this week are inaccurate, and they're not sure where the state got the numbers.
Got it. So what I can tell you, I can't speak to how the state got the numbers that were on the Excel spreadsheet that was released earlier this week. What I can tell you is that we did do a comparison and we did find some differences in the numbers. And our process is every day when we pull down cases attributed to Montgomery County from the PA NEDS system, which is the database that all labs are supposed to be reporting both positive and negative test results to. We do double check every name and address on that list as best we can. And we do find duplicates on that list some days, and we do find people whose address is wrong. One of the particularly tricky things with long-term care facilities, and this is part of why I mentioned when we do our self-report numbers, that not all those individuals have a permanent home address within that facility. For example, somebody could have had a recent stroke and be in that facility for maybe a couple months while they're rehabbing, but that is not their permanent address. And so we do our best to figure out where a person's permanent address is. And if it's in our county, then that goes into our count. If it's in a different county, it goes into a different count. So there are reasons why the numbers aren't exactly the same. All I can tell you about our long-term care facility numbers is that we do go through that list every day. Our teams are in, as you know, regular contact with the facilities, and we do our best to verify what we report to you.
The governor has said that he is going to be announcing more counties that will move into the yellow phase tomorrow. Are you getting any indication that perhaps he might be adjusting his metrics, that perhaps some counties closer to our region will be moving into yellow? Or is that just wishful thinking?
No information that he will announce that Montgomery County is moving into yellow tomorrow.
Thank you.
Thank you. Todd, any other questions?
There's a question from Jeff Cole from Fox 29. There's reporting that Democratic members of the state Senate, including a Montgo senator, are growing restless. Will it undercut efforts to combat the virus? Do you get a sense of local elected officials becoming restless?
Well, I think every one of us is restless. We've been here in the county, we're in our 11th week. And so, of course, everyone is restless and very hopeful that we will move into the yellow phase as quickly as possible, particularly owners of small businesses here in Montgomery County. But this is a data-driven exercise, and we report this data to you every day in the hopes that people will understand the very real and very serious challenge that we're in here in Montgomery County, and that they will do their best to take personal responsibility and be part of the solution in the way that they conduct themselves in the public sphere, in public spaces. So everybody's restless. And I look forward to the day when we can announce that we will be moving to yellow, but I don't yet know when that day is, but hopefully soon. If our numbers keep going in the right direction, I believe that we're getting close to that, but we still need people to stay the course and stay at home as much as possible, and in public follow all of the guidelines and practices that have been recommended.
I have a question from Christy Alito from 6ABC. Commissioner Gale, if you could go back, do you think you would have gone into isolation or worn a mask at your flag distribution event, especially knowing that you had been in contact with someone who tested positive for coronavirus?
Absolutely not. I wouldn't have changed the way I conducted myself last Saturday when I honored fallen military men and women that made the ultimate sacrifice protecting our American freedoms. I used my own judgment, and the people at the cemetery honoring these veterans were there at their own will. No one forced them to be there. social distancing was practiced for the most part. The clip which they refer to where I distribute and hand a flag is actually to a household contact. That individual was my brother. So it was a desperate attempt to try to redirect the arrogant and un-American and disrespectful decision not to provide these organizations American flags to use for Memorial Day. And I stand by my actions. I stand by these organizations that were not provided the flags, and I will continue to help these organizations and provide the proper respect that our fallen heroes deserve.
A follow-up question from Christy Alito. Commissioner Gale, as a voice for reopening Montgomery County, do you feel that your actions of not wearing a mask or isolating after coming into contact with someone who has coronavirus hurts your argument to reopen the county?
No, because from the very beginning, when this pandemic started, the number one goal was to make sure that our hospitals were not over capacity. That has not happened in Montgomery County. It's not happened in our region. And I am a healthy individual with no symptoms, and I would not be a burden or be placed in a hospital as far as I'm concerned. So the individuals that have to be careful and wear personal protective equipment and not participate in mass gatherings or any social activities, I believe have the intelligence to know what they have to do to try to avoid the coronavirus. So the number one goal was not to have overcapacity in the hospitals. That has not happened. And I am an individual that would not, for the most part, be hospitalized due to COVID-19.
The last follow-up question from Christy Alito. Commissioner Gale, what do you say to those who question the kind of example that you're setting for constituents?
There are many constituents across the county that deeply appreciate the example that I am setting. They are very frustrated and aggravated with the ridiculous draconian orders that are being placed upon them, and they do not believe that government should dictate how we should live our lives and how we should behave. And that's exactly what's taking place in Pennsylvania, and that's what's taking place in Montgomery County. Day after day on these daily conferences, you hear it, and I think that individuals know what to do, and we can provide guidelines, we can provide suggestions. Ultimately, we have to make sure that the healthcare centers have what they need and make sure that the capacity issue is addressed, and we have done exactly that. So I believe I'm leading by example for a large number of residents in Montgomery County that share my opinion, and they're very grateful that I'm taking these bold actions.
Thanks, Commissioner. We have one further question from Deanna Durante.
I just want to clarify on some of the numbers before. I want to make sure that my question was understood, so I'm going to try and ask it a little differently. I'm looking at a report here from Abramson CEO Carol Irvine, who talks about the cases that went into their facility in Wynwood, the Abramson Senior Care Center in Wynwood. She spoke to WHYY saying that the facility was 35 bed, but yet the state reported that they had 40 cases. She was also talking about data released by the state reports that nearly half the facility's capacity had passed away with 16 deaths, saying it was flat out wrong. She is one of many long-term care facility executives quoted as saying that the state data is wrong in terms of their numbers of residents that were affected by COVID. Not so much where they lived to be into the count, but that the numbers were wrong, she says.
Yeah. Deanna, I don't know what to tell you. We at the county level did not have any input or participation in how the state put together their numbers. What I was just trying to explain to you was what we do on our end when we pull down the reports from labs of individuals with positive cases. So I really have to refer you to PADOH because I I don't have any explanation or knowledge of how they put that together.
But then those numbers do come to you? The way that
No. Well, so yeah, my point is, I don't know how they gathered those numbers. What we get, what my team gets every day is a list off of the Pennsylvania NEDS database. And then they go through and check every address, and all those other things that I talked about.
Okay.
So I can't
Sure
explain
that we're
it.
clear
Yeah.
what those numbers are, because obviously, you've addressed it, we've asked it, that there's a lot of outrage about the numbers being included, and it's been a big point of talk with community members that want to see Montgomery County open. So I think they just want to make sure that these numbers are accurate. So when we look at the numbers from the state, they do differ from the numbers that the county has and what you're putting out every day then?
That's correct. Maybe I didn't make that clear at the outset. I'm sorry.
Okay.
Yeah, we did compare our list that we have internally to what the state had, or what the state released. And in some cases, they are different.
So then what happens, because you have addressed this before, that you've double checked and your numbers at times are lower than the state. So then, considering we have a number threshold we have to meet that the state is saying, which ones do we look at so that we can get to yellow, yours or theirs?
Right. So we continue to be in regular communication with the Pennsylvania Department of Health, sharing our data with them and looking at metrics. And they do understand, and at least with Montgomery County, have been willing to look at what we give them when they're considering our status here in the county.
So if our numbers are lower, they'll look at that rather than their own.
That is our hope, and we've got some indication that they are certainly taking our numbers into consideration.
Okay, thank you for the follow-up.
Mm-hmm. Great. Any other questions?
No other questions.
Okay. Thank you, Megan, for interpreting for us today, and we'll see everyone tomorrow at 3.